Well, hello again, everyone. So glad to see you, and this is our wonderful lecture for week 8, and so happy, not week 8, unit 8, and just so happy to see everyone. And this week we'll be talking about spiritual emergence and spiritual emergency. And so this is both a style of how we do counseling in the transpersonal modality, transpersonal counseling theory, but it's also something that's very unique to our paradigm because there are many other ways of understanding the kind of phenomena we're talking about here when we talk about spiritual emergence, and a lot of them are very pathological. They're terrible. So they really say that people having spiritual emergence and spiritual emergency are, they have a personality disorder, or they become psychotic. But it's really only in our paradigm that we open up the possibility that people that may seem on the outside to look very dysfunctional may be emerging from lower states of awareness actually into higher states of awareness, that actually wisdom may be born of the confusion that we see in front of us, which is a very unique aspect in counseling. There are very few traditions of counseling that properly appreciate that actually what might seem pathological could be part of a growth stage that becomes a wisdom. So that's what I really wanted to finish our last unit together using spiritual emergence, because it's another very unique part of our tradition. And we'll talk about these things some more when we see each other in the next residential section. We'll go over cases and things. But I thought it would be appropriate to end this way, because this is indeed something that's very unique to the transpersonal counseling paradigm. The idea that what appears to be neurosis and confusion could actually have a lot of sanity to it. And that can be good news for anyone out there, including myself, who's feeling a lot of confusion right now. That actually that confusion need not be covered up with some kind of false wisdom or faking it, but actually you could relate directly to the confusion and let it dawn as wisdom, so it is said. Okay, but anyway, so here we are on the first slide, spiritual emergence, spiritual emergency. And so let's go to the second slide. And so what are we going to talk about? 3 things. First one, what is spiritual emergence? What is spiritual emergency? Secondly, how do we assess spiritual emergence and emergency? And then finally, last one, how do we treat it? So we really have, want to define what it is, how we assess it when we think we're seeing it, how we get discernment into what's the genuine spiritual emergence and what might actually be, some severe psychopathology that needs a different approach. Or lastly, how do we treat? Okay, so let's go to the third slide. And so here we have a nice quote from Brian Courtright. And so he defines spiritual emergency the following way. Spiritual emergency refers to how the self becomes disorganized and overwhelmed by an infusion of spiritual energies or new realms of experience which it is not yet able to integrate. So you might wonder, what the heck is that about? New infusion of spiritual energies and new realms of experience? Sounds like a bad acid trip or something, right? And guess what? That's in a category of spiritual emergence. People having psychotic experience related to psychedelic experience. But this doesn't just happen with drug usage, in fact. In fact, ordinary people who have never used any kind of psychedelic substance can have this from time to time. And you may, in fact, know people in your lives who maybe it seemed like they were a little depressed or something, and suddenly it seemed like their realities are really coming unglued. You can see this all the time. Even people who are not necessarily engaged in spiritual practice, although it can happen more frequently in that situation, but people just suddenly reaching some kind of experience of emptiness in their life, and out of that emerges a really unstable way of putting the world together, and that could be labeled psychotic even. And so I'm sure everyone here, if you've known people like this, you can really relate to how the person both seems to have a lot of sanity at the time, but also seems really unusual. So let's go over some examples of this in a little bit. Let's go to the fourth slide. So here's some examples of this, of spiritual emergence and emergencies. So definitely this happens with mystical practices, and one of the most commonly reported one is what's sometimes called intense Kundalini awakenings. And you're like wondering, what the heck is a Kundalini awakening? Unless some of you practice Kundalini yoga. Well, what this refers to is that a lot of times when people are involved with yogic practices, such as even common, I've heard people having this experience with Iyengar yoga, something as common and as well known and grounded, and even in the research literature as being helpful. It happens. Sometimes people are practicing yoga and they suddenly start to feel tremendous surges of energy in their body. And this can happen in ways that we call spiritual emergence and emergency if it feels quite uncontrolled to the person and if they have no conceptual understanding of how this is a part of their path. I mean, it's different if you're, like, let's say, doing a practice where that is part of it, like Tumo yoga or some other thing. Then you'll have some teacher who's working with you and who explains this phenomena. I'm not talking about that. I'm talking about when a person is just doing what they consider to be normal yogic practice, or even they have the Kundalini energy and not doing any yogic practice, and all of a sudden they feel tremendous surges in their body of energy. And the really classic one is that people will feel a sensation of energy going up the, what we sometimes call the central channel, but maybe we'd just say commonly in language, up the spine. They feel like this powerful energy just coming up the spine. And a lot of times as it emerges, there can be blissful feelings, and sometimes even as it arises, a person can just feel like their whole mind dissolves into like a nothingness, just pure sentience or consciousness. And this can sometimes make people feel very manic and very panicked and very anxious. And so we would call this a kind of intense Kundalini experience. And so you do find people getting that at times and then really feeling like they're losing their mind. And people have actually come to me in therapy because they know that I've done work in this area in terms of both, actually I've done research measuring Kundalini yoga, and so sometimes people find me that way, in that I've done the neuroscience experiments around Kundalini, and so people come to me thinking, well, he's a therapist and also he knows about Kundalini, so maybe he can give me a hand here. And I try to, because indeed, if people, if someone doesn't know about these things, why a therapist might think this patient is just losing their mind. They're talking about this energy in their body, and maybe they're just bipolar, and they'll just think the person is bipolar, has bipolar disorder. Although even the understanding what bipolar disorder is problematic from most clinicians' point of view, but we'll leave that aside for another class. At any rate, and so that's an example of one of these categories. Let's look at some more. Others can be mystical or peak experiences. And so all the time in life, we have mystical and peak experiences at times. We may not always appreciate them as such, but let me give you a few examples. For many of you, if you've been married before, the moment at which you were getting married might have been a peak experience for you. And I hope it was, actually. I hope it was. I hope it wasn't the opposite of a peak experience. But I hope it was. I hope it was a feeling that you really felt as you looked around the room with the people who might have been there to celebrate your wedding. You felt deeply connected to them, and you felt the community of your family and your friends, and maybe some coworkers came, and then you see your beloved next to you, and someone is saying you are now married, and you can kind of have this really wonderful peak experience sometimes at weddings. I think that's why we like those kind of rituals. They encourage that. Well, what if you were having that kind of experience every day? That might be a little disruptive, right? And actually, it can be kind of a funny point there, actually, that maybe that would be a good thing. But if you're not really ready for this kind of experience of having peak experiences all the time and have a more non-dualistic understanding of that, and you have instead a dualistic understanding of peak experiences, why it can seem really strange, like everything feels doubly real to you. And in fact, it can feel so real to you that everything feels illusory. And now look how all these illusions of self and illusions of the world are coming up with this. And so people are really freak out, and all of this spiritual emergence and spiritual emergency, it's all about the person's inability to handle these insights into the illusion of the self and the illusion of the world. And are we saying that there's something wrong with them, that they couldn't handle that? No. I'm not saying that. Most of us aren't ready for that a lot of time, and that's a lot of what I love about being involved in the transpersonal model, is that it's really causing us to think about that actually these illusory experiences are a normal part of life, and people tend to run away from them because, in fact, they can be unsettling. And people, this isn't what I saw on the TV sitcoms. People don't have these experiences other than me, or if they do, they're often being made fun of. So what are some of these peak experiences besides the one I just described about getting married? Well, it can actually be a feeling of what's called unitive consciousness, and that was a little bit of what I was talking there. That means that you feel that your mind is one with everything. And, a lot of times if you've had this experience, particularly if you've been meditating for quite a while, or, if you're fortunate, you can get this fairly quickly, depending on what your proclivities are. You can really start to feel that as you meditate, even just doing simple mindfulness, you can start to feel at one with the environment around you. And is there something wrong with that, and that's a spiritual emergency? No. When it becomes a problem is when that freaks you out, to feel that, oh my gosh, it feels like my mind is dissolving in the universe. And wait a minute, where's myself? I'm losing it. And so this kind of mystical insight about the nature of yourself and its illusion and the illusion of the world can be very threatening to people and cause a lot of anxiety if you haven't really built up a stable base of conceptual understanding and a stable base of practice to hold that insight without freaking out. And so that's one of the reasons why when I assign techniques to people, I make sure that I'm using techniques that really seem suited to the person's level of mind-body ability. Because if a person really is not ready for that, it can be a high freak-out factor. So, anyway, unitive consciousness, Godhead, sometimes people have the sense that they have attained unity with deities. And so, the really most common one that actually happens quite a bit is that people start to feel, particularly in Christian countries, that they have attained something like a Christ-like state, and they even may say, "I'm Lord Jesus Christ." And I'm here to tell you, I have met Lord Jesus Christ over 20 times in my life, in emergency rooms at hospitals when I was doing psychiatric evaluation. I just kept running into Jesus, and the guise of another person, saying, that I'll actually have their ID, and I'll see what their name is actually Brian, or I don't know, not actually, but their name seemingly is Brian, I guess. And they're saying, actually, I am Lord Jesus Christ, and I'm here to tell you, Ian, that it feels. Actually, one guy just kept repeating the same phrases over and over. It feels so good, Ian. It feels so good. And did I tell you, Ian, that I'm Jesus? And it feels so good. It feels so good. Ian, it feels so good. I'm Jesus. I'm Jesus, and it feels so good. And I just came here to tell you, Ian, that it feels so good. It feels so good. So there's a lot of repetition. And in this case, this man really seemed to have a very powerful spiritual emergency where he felt that he had attained almost like the Christian version of enlightenment. He had realized his Christ consciousness completely, and so he felt the need that he had to share this. And it caused a tremendous amount of energy explosion, kind of like the Kundalini thing in him, though he didn't understand it that way. But he felt he was at unity with Lord Jesus Christ and went around telling everybody that, and was surprised when they instead threw him in the hospital and said he was insane, which is why I was evaluating him at the time. So that's what that could be like. Then another one is derealization of self, other, and world. So again, here's another, people sometimes have the feeling that as they have these mystical experiences of the illusions of self and other, they feel like the world is less real. I once met a gentleman who told me that he was actually asleep as I was talking to him, and I was just a part of his dream. And then he asked me to prove him wrong. And I said, well, that's very interesting, you know. If I'm just a part of your dream, then I must be asleep too. But how do you know that you're not a part of my dream? And so we had a nice philosophical talk about who was dreaming. And interestingly enough, that seemed to actually integrate some reality testing, and he decided that we were both dreaming. And that seemed to diffuse things a bit. But at any rate, so when people have difficulty with this, it can really make them to feel very anxious, and they can then start to feel like they're losing their mind and have panic attacks, and they end up at the hospital or some therapist's office worrying they're going to, excuse me, go crazy. Also, a person having near-death experiences can be a kind of spiritual emergency. I can't remember if I told the story already, but I have actually done research on near-death experiences with a very small subcategory of people who have what we called spiritually incongruent experiences in near-death experience. So what do I mean about spiritually incongruent? I mean that the person's direct experience of their near-death experience, their direct phenomenology, was not what they expected. So I think I told the story, so I'll just say briefly, of the man who I met who, in our research, he had an experience of, dying, having a near-death experience, and then after he leave his body while he was, clinically dead for a little bit, he arrived in a kind of heavenly realm, and there was Lord Krishna standing there for him with blue skin and everything. And the only problem with this guy was a white man from rural Florida. And he didn't know Lord Krishna. He didn't know what Lord Krishna looked like. And Lord Krishna told him a few things about how he shouldn't worry and he was going back. And he told him a few other things about what he was supposed to do, this kind of thing. But not to worry that he was going back to the world. And then he woke up, and it was like, well, wait a minute, he was expecting to see Jesus or St. Peter or an angel or something, and instead he saw this strange blue man, who he didn't even know who it was. And then subsequently I can't remember how long ago it was later, maybe a couple of months or something, he was at like an Indian restaurant, and they had the image of Lord Krishna with the blue skin. And then it's, holy shit, this is the person I saw. Now, who is this? And the owner of the store says, that is Lord Krishna, a Hindu deity. And then this caused a tremendous spiritual emergency for this fellow, because he's thinking, oh my gosh, I guess maybe there's no Jesus. Maybe I need to become a Hindu. But he was a member of a very conservative Christian church. And so he had to keep everything that he saw a secret from everyone, because he was afraid that no one would accept him if they knew that he had a near-death experience where he saw Lord Krishna instead of Lord Jesus Christ. Right, so a near-death experience could work this way, although, again, all of these things could be positive if the person was ready for it or if it matched their previous wisdom in some way. But if it didn't, or they're not ready for it, then this becomes a bummer. Like for him, it made him very depressed and anxious. Also, people can have anomalous and psi-related experiences sometimes that make them very paranoid. Like if they heard a voice, and then it seemed like that voice was actually coming from other people, and it felt like they're reading other people's minds, and it starts to make them feel crazy. Or if they saw a ghost. I actually have had clients who came to me because they feel like they're seeing ghosts all the time, and they're very worried about it, and they're very frightened of the ghosts, or sometimes demons. Also, sometimes people have disturbing past life experiences that make them to feel like they're going crazy. People sometimes take shamanic journeys, both with and without ayahuasca, but especially with. People can sometimes have these not that I'm going knocking on ayahuasca or other psychedelics, but sometimes people have bummer experiences with that, and you know, and it's very hard for them. In fact, I have a case later about exactly this, where a woman had a very strange ayahuasca experience that we'll be talking about. Also, I have had clients who came to me and said they were abducted by UFO and aliens and this kind of thing. And so this also makes them very frightened and scared that the aliens are coming back for them. With all of these things, there can be a lot simpler explanation. So I'm not meaning to say by any of this that I believe that all of this phenomena exist. What I do believe is that people experience this phenomena and that it's worthy of helping people with. I don't know whether there are UFOs or past life and all of this kind of stuff. I've had my own experiences, by the way, with all of these things, but my experiences are my own. And so I don't mean to particularly say whether these things exist or not exist, but they are things that people experience. And so we need to, particularly as transpersonal counselors, to be ready for people to talk about these things and to be open to what the person's experiencing, and then also to see what we can do to help them to cope with the kind of illusions of self and illusions of the world that they're bumping into by having these phenomena. Okay, also could be people have experience of communicating with spirits or channeling. I definitely have had a number of clients who particularly came to me with all kinds of anxiety and depression related to experiences they had doing auricular things. When I mean auricular, I mean not like with the ear. I mean like oracle, like they're using Ouija board or tarot cards, and they feel like something horrible is happening as a result of this practice. In fact, sometimes I've talked to some of you about this. I had a client who, not a client, I had a friend actually, this before I was a counselor, who used to use Ouija boards a lot, and she really lost it with this, really started to communicate with something that she thought was a spirit that maybe was a demon, and it kept telling her horrible things about herself all the time, really making her feel like she was the lowest of the low and nobody would ever like her. And then after a while she started to think this thing was stealing her items and possessions from her life. And as I mentioned later, I later found a simpler explanation of this phenomenon. It seemed like she was actually having dissociative episodes. But at any rate, communicating with spirits or channeling can do this, and just a person feeling like they might be possessed. So these are types of scenarios where we might think about the person having a spiritual emergence or emergency. Not all of these are going to be negative, and so that we couldn't really call that an emergency. They might just call that a spiritual emergence. In fact, that's the notion here, is that all of these things, if they're could be related to a person's evolution of their spiritual consciousness, of their spiritual emergence. But if they're not handling the illusions of self and illusions of the world that come along with this well, then it feels like an emergency. All right, let's go to the next slide. Let's talking about how do we assess this. So the first question is, how is this different than psychosis? Okay, because it seems to be a fairly different thing between a presentation of spiritual emergence and psychosis. So the first thing to say is, by the way, this all comes from Stanislav Grof's writings in '86. Actually, both Grofs, Stanislav and Steph. A person has changes in consciousness where there is a transpersonal emphasis. So that's the big difference between, one of the big differences between psychosis and spiritual emergency is there seems to be a transpersonal emphasis. So in a normal kind of psychotic presentation, the person may be talking about some fairly weird things, but they generally won't be talking about illusions of self and illusions of the world as a kind of spiritual or transpersonal development. Whereas people who are having this classic experience will commonly talk about that. They'll say, I was in the middle of this meditation retreat, and it seemed like I was making good insight, and the next thing I was overwhelmed by this Kundalini energy, and I had a panic attack and thought I was losing my mind. And then the person running the retreat said I should stop doing the practice. So there'll be some kind of context that has a transpersonal emphasis, or there'll be content or practices that will really cue you to this. It wasn't like the person was just watching David Letterman, and suddenly David Letterman jumped off the television and said that he was their master. So not like that. Okay, the next one says ability to see the emergence as a psychological or inner process. So 100% of the spiritual emergence and emergency, the person has some sense left of discernment of what's happening as a psychological or as an inner wisdom kind of like experience. And a person is just flat out psychotic, then they will just say things like, Donald Trump is controlling my bowel movements. They will, by the way, say things just like that. Or, the reason why I am crazy is because the woman next door has hidden LSD in my cornflakes. So they will just say all kinds of things like this. And they have a kind of sense to them, but what you're noticing that's not there is a psychological part of it. Whereas people who are having the emergence or the emergency will say things like, I was in the midst of this deep meditation retreat, and I got very deeply sad. I got sad. I was thinking about all these experiences of being abused as a child. And then all of a sudden, my whole body started vibrating with energy. And I was just vomiting and vomiting and vomiting and vomiting. I actually heard this story. Vomiting and vomiting and vomiting. And all this black bile came out, and I was frightened because I didn't know what it meant. And so the person in that case is actually talking about psychological process. They're making reference to trauma, and that somehow, yes, they're vomiting up black bile, but they're saying that in relationship to a psychological process of using meditation and then suddenly purgating a kind of traumatic experience. Okay? Now, so these take some discernment on your part as a counselor. This is another reason why you must be engaged in transpersonal practice, and you must be engaged in contemplative practices, and you must be understanding transpersonal phenomena, the illusions of self and the world, in a way that you can understand other people's difficulties with emergence and emergency. If you haven't done this yourself, you're just going to see everything as psychotic. So partly, your ability to see and assess whether something is psychosis or whether it's an emergency is going to be not just the person that you're assessing, but you. So you should be very careful about making sure that you are constantly working on developing your own wisdom and your own love and compassion so that you can really have the discernment necessary to work with these situations and, let the psychosis be the psychosis and let the spiritual emergency be the spiritual emergency. And the last thing on this list, it says capacity to form a therapeutic relationship. That's just kind of a necessary thing. You can't work with somebody if they won't work with you. So if someone is so psychotic that they can't even hear you, and that does happen, that they're hearing voices so loud they can't actually really hear anyone talking to them, and you'll see those people are kind of like this all the time. And then we make eye movements and even be looking at things you can't even see. But it does happen that some people become so psychotic they can't even respond anymore. And sometimes they get into a state called catatonia, where they even won't move, or they kind of get stuck in a rigid position like this. So capacity to form a therapeutic relationship is important too. Now let's go to the next slide. And this is, how do we treat spiritual emergency and emergence? So this is much easier than I think. Once you have decided that you really have a genuine case and you have a therapeutic relationship that you can work with, these are just very simple things. And the difficulty with doing simple things in the case of spiritual emergency is that this person is saying all kinds of wild and weird things. And so you might think they're saying wild and weird things, so you need to say wild and weird things back to them. You don't. What you need to do is be very loving and very simple. You see, this person really needs to be grounded back again into the wisdom that can hold the illusions of self and the illusions of the world. So if you do nothing else, then just remember this. You need to be simple. You can of course try to meet the person where they're at, but you don't have to start saying, I see the aliens too, and the aliens are right behind the door, look out. Of course probably no one's going to say that, but the most important thing is to stay grounded and simple and to relax while you're with the person. So the first thing says, promote a positive context for the client's experience. So when the person is telling you about these amazing and bizarre things, you provide a very positive way of saying, oh yes, I understand what you're saying. And you really use good client-centered psychotherapy. Don't try to dispute whether the thing is happening or not, but instead just be with the person and slow down and listen to what they're saying. And even you doing that is going to slow down their breathing. And a lot of times people doing these things are hyperventilating. And that induces more anxiety and induces more psychotic-like features. So you really just need to promote a nice positive context for their experience. So you don't dispute it, and you say, you know, actually this, if you think it really is a spiritual emergency, then you say, I think you're going through a spiritual emergency. That you've had some insights into the illusory nature of the world and yourself that you're struggling with. And so I'll be here with you. And you just tell me what you're feeling, and I'll listen. And together we can understand this and help you to become comfortable again. But you'll gain some wisdom along the way. So next one says, provide them with information about the spiritual emergence process. So that's what I was just talking about. You let people know that actually they weren't the first person in the world to start feeling like they were losing their mind when actually they were gaining insights into it. Actually, there's another school of thought besides the transpersonal that's not as well known that really talks about this. It's Kazimir Dembrovsky's theory of positive disintegration, which probably most of you will never get a chance to even study that theory. It's very interesting. But he believes, in particular, that people with borderline personality disorder are more advanced than other people because they have a kind of emptiness of self and concepts that makes it possible for them to understand the real nature of reality. And as you can imagine, he was largely laughed at in his time for saying that the people that other people said were incurable neurotics and incurable personality disorders were actually more advanced than the rest of us. But there's something actually kind of true about that. Well, for instance, the way most people think involves dichotomous logic. What do I mean dichotomous logic? Dichotomous logic means that you think all things are good or they're bad. But in reality, right, or everything is black and everything is white. But in reality, most things are that shade of gray in between black and white. And, you know, there's all kinds of flavors of things between good and bad. There's mostly bad and there's mostly good. There's halfway good and there's halfway bad. There's all kinds of flavors of that. And so a lot of times when people are experiencing these illusions of self and illusions of the world and having the spiritual emergence, they're actually gaining direct insight into that kind of non-dualistic logic and non-dualistic experience. They're struggling with a kind of illusory experience, and they might be acting as if it's real, but later on that may be instructive to them. Like, I don't know if many of you know this, but there are many traditions that have many shamanic and many indigenous wisdom cultures actually induce vision-like states into their adherents. So like a good example in Native American tradition, they actually will get people to fast and pray for long enough or spend time meditating in nature with very little food or clothing until they actually experience visions that, you know, in other cultures we would say, you know, pull out the thorazine, but actually they want the person to have a kind of illusory experience that gives them a sense of the illusion of self and the world. So we say these experiences you're having, although frightening, may later be very helpful in developing your wisdom and developing a healthier sense of yourself. So it provides a nice positive context, right, to say this, that other people have experienced the same thing for millennia, not even just for the last 20 years, but since the world spiritual emergency has been around about 30 years actually, but actually for millennia, people have actually been having these kinds of freak-out experiences that actually later on become quite wise and loving. All right, so then the next one says, move away from the concept of disease and focus on the potential healing and transformative nature of the experience. So I've had plenty of people tell me that they just thought they were losing their mind. Indeed, the case I'm just about to talk about, a woman came to me saying she was hearing these voices and she felt like she was losing her mind. And so I thought, okay, I'll assess this. And I said, well, how did you start hearing these voices? And then, as you'll see in the next couple of slides here, she said, well, it all happened when I started, when I went down to South America and did some ayahuasca. And I was like, oh, wait a minute, now this may not be your normal voices thing. And indeed, so what I started telling her was that, actually, you're not the first person to hear voices after taking ayahuasca. And actually, did you ever talk to the shaman that helped you lead the experience about this? And actually, there's a stage in many shamans' life where hearing voices and being introduced to different aspects and guardians of the mind, of this kind of thing, and familiars. They have a lot of different terms for this, tutelary deities, so all kinds of terms for this. That actually maybe, this is a very powerful and beautiful spiritual thing that happened to you, although you seem to not have any connection to a lineage, so we need to figure this out from a different perspective. Okay, but anyway, we'll talk more about that case in a second. So focus on the potential healing and transformative nature. So if nothing else you do, stay positive. Stay grounded and positive. The person is freaking out, so you need to hold the positive ground for them. Like, look, I know this is disturbing to you, but many other people have gone through this experience, and it's quite possible that at the end of this, that you're going to actually feel pretty good about this, but you're not ready yet, and so we're going to do some nice simple things, and we'll talk about what we do here in a second, to help you to feel better and to regain your sense of comfort and regain your sense of feeling grounded, I guess. Also, try to involve the client's social support network. That's another thing that will restore a sense of, I guess, the illusion of the world. A comforting illusion of the world. If you bring in some of the person's social network, and people will, hug them, and so that doesn't even have to be an illusion of the world, but just basic comfort and loving feelings. All right, let's go to the next slide. So here are 8 steps. First of all, how do we treat this succinctly? First of all, resolve any crisis situation. So the person is a danger to themselves or others, you got to send them to the hospital, right? Because unless you have some other way of containing that person, like, I don't know, if you happen to be in some kind of residential setting, then actually you could do that instead. But in most cases, if you're in an outpatient setting, you're in just a normal therapist, not in like Chestnut Lodge or some other amazing place like that, you can, you might need to hospitalize the person so that they don't harm themselves or another person. And you try to aim to reduce the frequency, duration, and intensity of the most distressful feelings. So, a person can have all kinds of illusions of self in the world, but it's really the anxiety they're having about them, or the kind of paranoid feelings that we would be worried about there. Second one, normalize the experience. So that was a lot of what we were talking about. Tell them about the spiritual emergence model. Third one, encourage emotional release catharsis through creative expression. So, a lot of times you don't even have to say anything. You can just go and get some paper and some kind of, crayons even would be fine, or some paint, or I don't know, whatever you got. Just even a piece of paper and a pencil and a pen. And can you draw what you're feeling? And believe it or not, in the spiritual emergency, even people who normally don't think they have much artistic expression often produce like amazing works of art. It's almost as if that wisdom is really driving creativity in a new way. So even you're not a trained art therapist, just tell somebody, draw what you're feeling. Okay, number 4, psychotherapy to integrate the experience. So just use your normal phenomenological therapy style with them and ask them what they're experiencing. Number 5, help the patient to reduce environmental and interpersonal stimulation. So in these kinds of situations, people are usually like maximally activated by internal things, and so you don't want to put them in an environment that's also really maximally stimulating, because they're having trouble enough. There's a really interesting thing about the nature of the human mind that is, how shall we say, not realized. It has a limited capacity to process things. And I think that is one way in which you can kind of understand when you're reaching those higher aspects of mind, because they don't really seem to have much limited capacity. You can tap into unlimited love and unlimited wisdom and feel unity at even a cosmic level. But the mind, part of your mind that seems to suffer, often has a limited capacity. So what you want to do is to really reduce the stimuli that are really overstimulating the person as much as you can. And you can't turn off the inner stimuli. Well, it depends on your skill level with hypnosis and other things and meditation. You can do things to affect the inner world too, which we'll get to later. But at a practical level, anybody can turn the lights down. Anybody can make sure there's less noise in the environment. Anyone can say, well, why don't you like go rest in your room, or why don't you put these, even ear things, little earplugs, and so there's all kinds of things to do to try and reduce the environmental overstimulation from the person. Number 6, have patient consider temporarily discontinuing spiritual practices. So I even already mentioned an example of this. A lot of retreat masters are looking for this kind of effect, because they know that people can have these kind of momentary experiences and states that are unstable, and some of them are actually really, like we're saying, are very good in the long run. It's just in the short run where the person can't handle it. So you may want to say, maybe this is a good time to back off doing your meditation practice, and instead, why don't you that was making you to feel so blissful and making you to feel so crazy, why don't you why don't you and I just go for a walk outside and just experience being in nature that way? Okay, number 7, suggest that the patient eat a diet of heavy foods and avoid vegan diet and fasting. So this one actually comes from old literature, I mean ancient literature. A lot of these ancient yogic practices, they often say there are some foods you should avoid if you want to experience the deeper states. And so you can actually then do the opposite if the person wants to sort of get out of the more, how shall we say, ungrounded energetic states by actually eating more meat, strangely enough. For those of you who are vegetarian, that doesn't apply, but eat more starchy foods or something. And so eating more of the heavy foods, it is said, will sort of keep the person out of these ungrounded blissful states, so to speak, or energetic states. Number 8, evaluate for medication and refer to a psychiatrist. So this you got to be really careful with. You want to always know the psychiatrists in your community that are not going to overdiagnose someone who you think is having a spiritual emergency, and who, in fact, they're not going to say someone's psychotic when it seems like they're having a spiritual emergency. So you need to know who the right people are to call. And so that's going to take some knowledge. And so one way you can do that is you can, join local groups that are involved in related phenomena. Like here in Boulder, we have the various psychedelic research groups that are involved in doing MDMA research. And so guess what? The psychiatrist involved in doing MDMA research, they're the right psychiatrist to send these kind of clients to in most cases. But also you can meet psychiatrists in all other kinds of organizations in your local community. Like I've met many great psychiatrists at hypnosis conferences, at humanistic psychology conferences. If you meet psychiatrists in those kind of contexts, probably they're going to be a good one. So if you don't already know some psychiatrist who's good like this, you need to find out who is one that is more open to talking about clients' wisdom and not just trying to medicate everybody, no matter what the situation is. Right, so let's look at second to last slide. I got 3 basic, because I said a lot of things there. So like, Here are 3 things that always work. Number 1, stay positive. If the person is freaking out, you can start to make you freak out. You're like, oh my God, I'm going to lose my license. This person is losing their mind. They're under my care. Oh my God. And so if you get all freaked out, then that's just going to resonate in them. But if you start to stay positive with them, then that's going to resonate in them too. And eventually it'll help them to be more positive. Number 2, normalize, normalize, normalize. So tell them about the spiritual emergence model and just normalize everything. Number 3, test the limits of the emerging wisdom in a safe way. Now, that may sound a little crazy, and so I have a case where that's important, and maybe we'll talk about that, maybe actually at the retreat rather than now. But yeah, if some kind of wisdom is coming out of this state, you might want to have the person try and check this out. Okay, so actually, I think this last slide is about a woman that I was referring to earlier who had ayahuasca experience. And so I think I'm actually going to hold talking on this case until our time together so that we can discuss it more together and get your ideas and feedback too about what you might have done. And so we'll review this again. I think I'll just make this lecture a little shorter and just save this last slide for when we meet next. But at any rate, so I'm sure actually some of you watching today have had a spiritual emergence and a spiritual emergency. I know I have. And so, that will really help you, actually. That will really help you. So it's also okay to tell your clients who are having spiritual emergence and emergency that you went through that experience too. So maybe that's my final thought on this, is that share your own experience if you've had some. And also talk about how you work through it, and hopefully how it's led to you feeling more grounded in the world and feeling more wisdom and love in your life. At any rate, so until I see you next, I wish you well, and thank you so much for watching.